Good evening, everyone. We are back for a new session. Bonsoir, bonsoir tout le monde. My name is Cynthia Lane. I am the founder of Black Autism Coalition. And alongside me, I have Fabienne Guerrier, which is our board member. We're so glad to have you, Fabienne, here with us tonight for another session on myself. So, aujourd'hui, nous allons parler de myself et nous gagnons Fabienne qui est là pour interpréter pour nous. Et nous saluons et nous disons merci d'être côté pris de côté pour capable aider Black Autism Coalition comme vous toujours a fait dans le background, dans supporter nous. Et je dis à son session et nous voulons tout le monde pour capable partager. Make sure that you guys share it because it's going to be a lot of great information. I know a lot of you guys have myself but don't know about the benefits of myself. So, c'est une opportunité pour nous capable connaître et qui ça myself y et qui bénéficie. Nous avons invité nous qui là que nous allons introduire très bientôt. Et pour un petit temps partager. Mais avant que nous introduisons, nous avons Fabienne qui là, que nous avons un petit temps pour capable saluer tout le monde. Et je nous dis, allez, pour faire interprétation aujourd'hui, et nous allons faire entre nous deux tout. Et pour capable sûr que moun qui parle créole yo capable comprendre ça qui passé. So as we said, this is gonna be Haitian Creole and then also in English. And we have Fabian that's gonna be doing the interpreting. So we have our guest that's gonna be speaking English, and then we have Fabian that will be speaking Haitian Creole for our parents that speak Haitian Creole. So before everything, Fabian, welcome. We are so glad to have you tonight.
Hello. How are you guys? I'm happy to be here. Happy that I'm able to participate in the training session tonight and be able to use my skills to be able to facilitate this amazing session. M kontan la ave nou gen kek jou nou pa wè. Donc, même len pa wè, m konen toujours la travay pa de le ou bezwen. Donc, m kontan la pou m aider faciliter échange d'informations que je viens porter pour nous sur myself.
Oui, encore merci Fabienne. Et nous gagnons deux invités spéciaux nous qui là et que nous allons venir très bientôt ensemble avec. So we have our two guests. We have with us Amy. So now Amy's family, you guys already know who she is. Amy Weinstock that's been working along with us, bringing information to our family and as well to supporting our Haitian community in the language barrier that they have by helping them navigating insurance and also have the information that they need. And we welcome you, Amy. And we as well have Susie Dravinis. Am I saying it right? Susie, okay. And we want to welcome you to our show. And before I pass down to Amy and also to introduce herself and also you, Susie, I'm just gonna read briefly the bio of Susie so you guys can get to know who she is. So as far as Susan, I will say Susan, she is the insurance navigation manager for the Insurance Resource Center for Autism and Behavioral Health. She brings with her 15 years experience from Massachusetts Health Connector, where she wore many hats, including creating and facilitating trainings for navigators, certified application counselor, call center, and internal staff. Suzanne is a proud mom of 12 years old son, Constantine, who is also in the club. When the IRC was just starting out and needed support from the Health Connector, Susan made sure her fellow colleagues understood just how important the work the IRC was doing and assisted in creating workabouts to make sure these families receive the coverage they deserve. Susan is beyond grateful to be part of this team and to be certified application counselor to help families through the online massive application and navigate their insurance options. So we are so glad to have you, Susan. And I know you have helped myself and my family, and we can testify from that. And I always say to people, when you have your personal experience, you can brag about other people, about what they do. And, we brag about, what you guys do at the resource center, helping family, understanding. And as Amy said, you get to the family on time, not waiting for 2-3 days, but as soon as you leave a message or an email is being sent out, you make sure you connect because you guys are parents like ourselves. So we say welcome. And Fabienne?
Suzanne, Jwenn, c'est manager navigation assurance pour Centre ressources assurance pour autisme et santé comportement IRC. L'hypothèse avec lui 15 années d'expérience sorti dans Massachusetts Health Connector, côté il a joué plusieurs rôles, tant que créer et faciliter formation pour navigateurs, conseil application certifié, centre appel à employés internes. Suzanne, c'est une maman fière pour petit garçon li Constantine qui a 12 ans et puis qui tout fait partie clip là. Le IRC te fait qu'à commencer et puis il a besoin de support dans Health Connector. Suzanne t'a assuré que collègues li te comprendre l'importance travail IRC à faire. Il t'a aidé création solution pour assurer que famille sa yo te recevoir couverture assurance yo mérité. Suzanne sentit li extrêmement reconnaissant pour faire partie de l'équipe ça et puis servir comme un conseil application certifié pour aider famille avec application Mass Health sur internet ak naviguer option assurance yo. Les soucis pas parler sur assurance ou ka joindre li ap fait pâtisserie, passer temps avec famille ak zami ou soit ap chanter musique, théâtre dans machine li. You're muted.
Thank you. Welcome, both of you. And I will let you guys speak if you want to just add anything, and then we'll be here to assist.
That's great. Bonsoir and merci. And that's about the extent. But I'm so glad that to be here. And really, we've always been a powerful center, and we've always been committed to helping families and being responsive, because as family members, there's nothing more frustrating than, not getting a call back, not hearing from anybody. And what we hear is that when you're especially from a different language and a different culture and might need more support, that it can be even harder to get that response. Excuse me. So we are delighted to work with you and be here, and thank you for that introduction. Just a little history about our center. We've been around for 15 years, and for the first 8 or 9 years, we did very good work, but it was myself and a few others, and we had insurance cards, and we knew that there were laws requiring insurance to cover treatment, but we did not have the depth of knowledge that Susie brought to our team. And not only did she bring this intimate knowledge of the Health Connector and the underlying systems, she also brought a capacity to our team. I like to say she brought the keys to the system. So before we had Susie, one could call our center and tell us that they were having a problem, and we would reach out to colleagues and figure out what the problem was. And it would take us sometimes a little bit of time to sort through it. And we were effective and we got through it. But Susie brought the keys. I like to say she can look under the hood. And so now when someone comes to us with, usually a train wreck, Susie can look in and say, oh, there's 3 applications in the system, and that's why it's blowing circuit breakers and nothing's working. So it's really expanded our capacity and functionality in a huge way, and we're so grateful. And what is not in her bio also is that she is Greek and she makes a mean baklava, which has not been good for my waistline, but is beyond delicious. So with that, we will get into tonight's topic. I want to, if someone could bring up the slides, I want to just give a disclaimer. We are going to talk about Mass Health as it relates to coverage for people accessing treatments for autism and behavioral health. We are not Mass Health. We are not the Mass Health experts, but we can explain how the systems work for our families and how we help families. So who is driving? Oh, do you want to translate that? And then somebody.
All right, Amy, next time we're going to slow down a little bit.
Okay, I am sorry. You can say merci and bonsoir, and Susie is amazing.
Go ahead, Fabienne.
M'da essayé écrire tout ça l'a dit, mais malheureusement m'pa prendre tout parce que li ba puis l'information. Parce qu'il était juste saluer nous et puis il était a parler de centre là qui a 15 l'année depuis là et dans 8 à 9 premières années, c'était lui-même avec quelques autres monde qui étaient là, mais les Suzy viennent entrer, il y a quelques bagages qui étaient qu'on passé par en bas, qui pas passé par en bas encore, il toujours un moyen pour résoudre problème qui gagne, pour garder en bas machine pour qui ça problème là. Et il dit comme ça que comme nous pas dit Suzy c'est grec lié, sous ils font un baklava qui est enragé, donc qui a pété fait rien tellement il fait le gros.
All right.
Great. So can we go to the next slide, please? Okay. So if you've been to the prior presentations, this is who we are. And the most important thing to remember is our phone number. You can call us for help. And we also have information on our website. Next slide. So we are going to give I'm sorry, can you go back to the slide? I went too fast. Okay.
Notez ouais ça déjà, mais ça qui est important sur partie ça c'est numéro de téléphone pour nous capable entrer en contact avec nous. Donc prends-le.
And good afternoon, Philomena. I want to say if anybody has questions or issues from the prior presentations over the last 2 weeks, feel free to put those into the chat and we will try to answer those as we go along.
Si il y a quelqu'un qui a une question sur la présentation que nous avons fait dans 2 semaines qui passées, nous lisons pour nous capables de mettre des questions dans les commentaires, nous capables d'essayer d'adresser.
So what we're going to review tonight relative to Mass Health is just a bit of an overview of the system, how it helps people with disabilities, people with autism, people with behavioral health needs. And for many families, they have Mass Health as secondary insurance to their primary insurance. And we're going to explain how that works and the costs and benefits and something that we call the best kept secret in the state, which is Mass Health Premium Assistance. And then how Mass Health helps with covered services and if you need to apply, how you go about that.
Je dis, on a parlé en général de Mass Health, comment que li aider moun qui gen disabilité et dans pile famille qui gen Mass Health comme assurance secondaire et n'a pas parler tout de secret qui pi gros qui que yo kembe secret ça c'est ça les Mass Health Premium Assistance là on a parler sur ça et comment que ou capable appliquer pour bien service ça yo et comment Mass Health aider à service qui couvrir.
So next slide, please. And I'm going to turn it over to Susie.
Sure thing. Okay. So Mass Health, there are several different types of Mass Health. And sometimes, when people call, that's the first thing we try and find out is, what type do they have? I'll stop.
Il y a différents types de Mass Health. Les moun relè, premier baganoui, c'est connaître c'est qui type de Mass Health que vous gagnez.
And the different types are, based on different factors. So, they range from the income, from your age, special circumstances like having a disability. You need to have citizenship or immigration status, and you must be a Massachusetts resident to get Mass Health.
Il y a différents facteurs qui déterminent qui type de Mass Health gagne. Vous regardez revenus, vous regardez l'âge gagne de l'air, vous regardez si gagne des circonstances spéciales qui incluent sous gon disabilité, vous regardez si son citoyen américain ou bien qui stat immigration qu'on gagne et faut que ou son monde qui rete dans Massachusetts pour capable gagner Mass Health.
And those factors will determine if a person, family are eligible for Mass Health Standard, Mass Health Common Health, or Mass Health Family Assistance.
Et ces facteurs, ça va déterminer si on individuel ou bien en famille éligible pour Mass Health Standard là, pour Mass Health Family Assistance là, ou bien Mass Health Common Health là, et puis etc.
So when families come to us and they have someone in the household who has a disability, they are usually eligible for Mass Health regardless of income. And those two most common types that they might have or be eligible for are Mass Health Standard and Mass Health Common Health.
Là, on moun vini et puis on moun nan famille yo qui gagne une disabilité, le plus souvent n'importe quel que soit qui revenu qui yo gagne, yo normalement éligible pour Mass Health. Et type de Mass Health qui plus commun que moun qui gagne disabilité éligible pour lui, c'est Mass Health Standard là, avec Mass Health Common Health là.
Yeah.
I just wanted to add that people don't have to know what kind of Mass Health they are eligible for. There's just one application. The reason we say this is when someone calls us and they tell us they have Mass Health and it's a different form of Mass Health, that usually is a flag to us that something might not be right with their application.
Oui, je devrais ajouter que ou pas obligé connaître qui type de Mass Health ou éligible pour lui parce que son seule application que lié. C'est juste gain de gens monde qui relé qui dit que au bon type de Mass Health, les dit qui différent de ça nous connaît les dit ça, il fait nous connaît penser que OK gon bagage qui pas normal dans l'application que vous fait.
And these two, Mass Health Standard and Mass Health Common Health, are the exact same coverage type. And the only difference is that Mass Health Standard does not have a monthly premium, whereas Mass Health Common Health does. And we're going to get into more detail on that.
Deux types ça yo même exact protection. Seule différence qui gagne Mass Health Standard là lui-même li pas gagne premium mensuel qu'on paye et Mass Health Common Health là gagne.
All right. So, all right, Mass Health Standard. So when someone has Mass Health Standard as their primary insurance, so it's the only insurance they have, they will be asked to pick a network, pick a plan, ACO or an MCO.
Là que on moun gagne Mass Health Standard là, et c'est seul lui-même qui a gagné comme assurance, comme c'est celle qui a gagné, il a demandé ou puis choisi un plan dans réseau qui c'est ACO ou bien MCO plan.
And it's really important to understand that primary care physicians or pediatricians can only be in one of those plans. If they take Mass Health, they're in one. So many times members will enroll in the plan where their primary care physician is attached to it under that network.
Donc, il faut nous connaître tout que si docteur principal de soins généraux là avec et pédiatre là, yo capable seulement dans yon nan plan ça yo.
Okay. And then people with complex needs or disabilities, they may want to select a plan based on their access to the specialists that they're utilizing. So sometimes families will need to choose between plans that have their primary or choose a plan with their specialists. And this can be a difficult decision.
Moun qui gen besoin qui complexe ou bien disabilité capable besoin sélectionner un plan qui basé sur accès que ou gen en série de spécialistes que ou besoin et ça qu'on fait difficile pour choisir parce que plan qui gen spécialiste là un plan qui gen docteur soins général là elle qu'on difficile pour faire choix ça.
Now, behavioral health benefits play a big piece for a lot of our families. It is what covers ABA, so you also want to understand that behavioral health benefits are managed by managed care entities. And a few of the different ACOs have different MCEs. For example, WellSense members are going to go through Carelon. Mass General Brigham members will access it through Optum.
Benefis comportement yo couvri quand yo c'est bay ça qui normalement couvri ABA et yo gen différentes entités que yo qui gérer et gen différentes entités pour chaque ACO tant que par exemple après moun qui membre dans WellSense les va recevoir service ABA c'est à travers Carelon et moun qui gen MGB membre de MGB yo même recevoir ABA service ABA à travers Optum.
And, that's just nice to know. Usually on the card, they'll have both phone numbers for the medical and for the managed care entity, but it's just for families to understand where they should be calling for those different benefits.
C'est juste un petit bail pour nous connaître en plus. Tous les deux numéros à là-dedans, la bien information ni pour soins principaux ni pour entité qui prend soin que manage care.
Now, for many of our families, they have Mass Health as a secondary coverage to a primary employer-sponsored plan.
Quand pile dans famille yo qui gagne plan Mass Health là comme secondaire à plan assurance qui yo gagne à travers travail yo.
If this is your situation, then you should not be enrolling or you should not be enrolled in an ACO plan that I just spoke of.
Et si c'est situation pas supposé inscrire dans plan ACO en comme ça parler de lui.
Now, if you are automatically enrolled in an ACO or you get a notice saying to choose a plan, then that usually means that Mass Health does not have information on your primary plan.
Si que ouais yo assigné automatiquement avec plan ACO normalement vle dit que Mass Health pas gon problème d'application, Mass Health pas gen information sur assurance principale ko gen.
This is something we do a lot at the Insurance Resource Center, is helping families get this information over to Mass Health. So if this is something that you run across, you can feel free to reach out to us and we can help to get this information in place so that Mass Health is secondary.
Ça son bagay que nous fait en pile dans centre ressources assurance que nous gagnons que côté que nous assurer que information arrive joindre Mass Health. Si c'est ou même notre contact avec nous capable faire ça pour.
Okay. And typically Mass Health as a secondaries is usually Mass Health Common Health, and their behavioral health benefits are through Carelon.
Typiquement moun qui gen Mass Health secondaire là, c'est à travers Mass Health Common Health que gen li et plan c'est avec Carelon.
All right. So Mass Health Common Health, this is are eligible for Mass Health as secondary, even if they have other insurance. All right. Mass Health Common Health, I consider the door, let me start over. So Mass Health, we have the front door to Mass Health, and we all have to go through it. And usually that's the first time that a family with a young, a loved one with a disability will get denied insurance based on income, right? I call Mass Health Common Health the side door, where we get them in based on a disability. When you go, I'll stop there.
Et on dit Mass Health normal là li tant qu'on gen porte là premier porte d'entrée que ou entrer là-dedans et puis parents pas yo rejeter application parents parce que basé sur revenu. Nous considérons Mass Health comment faire tant que son porte sous côté que nous arriver faut joindre Mass Health là sous base disabilité.
Okay, and so Mass Health Common Health will come with a monthly premium.
Myself Common Help la vini avec un premium mensuel.
And Mass Health will always, want to be the payer of last resort. So if there's ever a question of, a family asking, is it primary, is it secondary? Mass Health will always be secondary if the family has a primary insurance.
Et Mass Health a toujours voulu, c'est eux même qui pour dernière option. Et si quelqu'un vous pose des questions, si c'est principal là pour utiliser, Mass Health toujours voulu pour les secondaires.
Right. All right. There are, like we mentioned, there are a number of different types of Mass Health. There's Mass Health Family Assistance, there's Children's Medical Security Plan, and Mass Health Limited.
J'en te dis, il y a différents types de Mass Health. Il y a Mass Health Family Assistance là, il y a Children's Medical Security Plan, il y a Mass Health Limited là tout.
Unfortunately, these types of Mass Health have little to no coverage for behavioral health treatments. And that's why we, want to talk to these families and make sure that if we can, what we kind of call like upgrade the Mass Health to get behavioral health coverage in place for them.
Malheureusement, plan ça yo même qui devant nous pas vraiment gain couverture pour traitement comportement dans plan yo. Et si on monde qui gain disabilité, yo a bay on l'autre en plan.
So we would just encourage families, if you are in one of these types or you don't know even what type of Mass Health you have, to give us a call and we can figure that out for you and what next steps you might have to take.
Et nous encourager parents si quand vous gagne un plan ça yo, bon pas connait qui plan qu'on gagne, rentre en contact avec nous capable bon information de qui prochaine étape pour prendre.
All right. So there are costs and benefits of adding secondary coverage. So, I always say if it's Mass Health as a secondary coverage, you're going to show your primary card and your Mass Health card anywhere you'd go, any provider, whether it be to the ER, to the pediatrician, to the ABA provider, or to the pharmacy. You're going to show both cards at all of these locations.
Bénéfice avec combien coûter ça le coûter pour ajouter un plan secondaire, en protection secondaire. Et pour ça, faut aller n'importe qui côté, dans n'importe qui, si c'est cas docteur, soins généraux, si c'est cas pédiatre, si c'est dans salle d'urgence, si c'est pharmacie, si c'est mon qui bail service ABA, toujours bail ni quatre assurance principale ni quatre Myself là.
One second, sorry. I just want to add one thing. I'm going to add it in Haitian Creole. Raison, m'te juste voulais ajouter un bagage. Raison que nous voulons faire parents yo connaît, c'est pour montrer deux cartes là. C'est peut-être pour pas joindre yon bill vin joindre ensemble avec vous parce que plusieurs fois yo capable gen on cop que vous voulez pour payer comme on copé par exemple pour ça tout couvrir par lui-même et moi dit ça c'est parce que c'est expérience que nous fait de ça là Dani et Jean Souzi dit là for sûr que vous montrez tout de quatre. One thing I was trying to make sure is the reason of that because I experienced that myself too. When you don't show both of your cards, you can end up with a bill and then now you're surprised.
Exactly.
So I just wanted to add that we had experienced that ourselves as well too. Thank God they were able to fix that. So you'd rather fix it earlier than have to deal with it later.
Yes. Thank you. So, and wherever they're both accepted, then there should be little to no cost to the member. So we'll start, sometimes we'll get calls from families that have Mass Health as a secondary, but they're like, but when I go here or there, I'm still getting charged. And we have to really make sure that they have the information that they need to be billing Mass Health. So that's the benefit, and there are other benefits. I'll stop there.
Si côté que Wally l'accepter tous les deux quatre ça veut dire que presque pas vraiment gagner pour payer et ça fait gagner plus de monde qui dit oui mais chaque fois m'aller là toujours fait me payer c'est parce que nous pas bail en deuxième cadre secondaire là.
And there are other benefits that, some people don't think of. One is for young loved ones that might still need diapers that can sometimes be covered if it's medically necessary. There's transportation to providers' offices like ABA that sometimes our families, it's very helpful to utilize. So these are additional benefits that sometimes, people don't know about. So.
Et gen l'autre bénéfice additionnel côté que pour kakou si moun ki piti qui dans famille si kakou yo besoin diaper couchette et que li yo besoin médicalement yo besoin ça li capable couvrir tout et si yo besoin de transportation pour y aller rendez-vous docteur ou bien rendez-vous ABA li couvrir tout ça c'est des bénéfices additionnels qui viennent avec.
Okay, so those are the benefits. Now we need to explain the cost, right? So there will be there might be a Mass Health Commonwealth premium, which is based on family size and income.
Ça nous parler de bénéfices qu'on y a parlé de qui ça l'a coûté. Gen droit gen on l'argent pour payer pour plan myself dans chaque mois et yo pral baser sur grossesse famille avec revenu qui rentre.
And and that's something we try and help families to get at least an estimate for. It's not, we're not Mass Health like Amy said in the beginning, but we do our best to try and kind of give some guidance as to what you might be, looking at for a premium for your family.
Nous ba une estimation qui ça capable pour un premium payant. Nous pas myself, nous pas capable exactement ça pied, mais nous fait tout ça capable pour nous être capable bon idée pour nous guider qui ça que montant pral lié.
And then the last piece that we look at is called that, the best kept secret that we call it, premium assistance, which if a family's employer-sponsored plan meets qualifications, which we will go through with families, then it will often really help to offset that premium and in some scenarios help to give money back to the family from what they're paying for that employer-sponsored plan. And we're going to go into more details.
Grosso que d'abdou que c'est le premium assistance là. C'est côté que yo ba assistance côté que sur non plan que employé côté au travail là c'est eux même qui sponsorisé plan ça et pour gon premium qu'on paye yo gen droit ba ou assistance pour payer ça comme yo rembourser l'argent ça ko ba là mais faut qualifier. Nous va parler plus sur ça.
Thank you. So we look at all these pieces when we talk to a family to make sure that it's going to be beneficial for the household to go forward with Mass Health.
Nous garder toute partie ça yo pour avec famille pour nous assurer que la bénéficiaire yo peut aller à l'avant avec Mass Health là.
Okay, so how is the premium calculated? So as I mentioned, it is based on family size and income, and it's on a sliding scale. So there's kind of no roof and there's no, so.
Zanzola yo basé ça au chargelan sur grosseur famille avec revenu qui entre et yo pas vraiment gon yo pas gon maximum mais pas gon minimum so ça veut dire que prix li monter le descend.
And it's typically based on the MAGI, modified, adjusted, gross income. And that is for for our children, for our loved ones, up until the age 19. So when you're applying through Mass Health, they look at the family income up through that loved one till they're 19 years old.
Donc yo typiquement basé li sur quantité l'argent qui rentre dans caille là avant yo prend taxe pour ti moun ça jusqu'à ce que il ait 19 ans.
I mentioned that because if you look at that little asterisk, so sometimes our families will, when a loved one with a disability is 18, they will apply for Social Security income, SSI. And when approved, they will get Mass Health Standard.
Mwen mensyone sa paske si nap gade ti aste ki an ba, kan pil moun le yo rive nan la 18 ans, yo vin aplike pou sa, pou SSI an, e si yo apouve, otomatikman yo vin genye Mass Health Standard.
Right. So that's the 18-19 split. And so we also have a lot of conversations with families around that age of what will be best for their loved one.
Oui, parce que dans l'âge 18 à 19 ans, nous faisons pile conversation avec parents dans la salle pour ka wè qui ça ka pi bon pour moun ke remè.
Okay, so Mass Health, getting back to the premiums, Mass Health has published rate tables every year. And there are two different Mass Health premiums. So when families do not have either access to an employer-sponsored plan or it doesn't meet criteria for premium assistance, they get what is called a supplemental or a reduced premium. Okay.
Mass Health gen yon tableau qui gen prix yo ki yo publié. Le ke moun nan li pa qualifié comme si avec un assurance que employeur la sponsorisé ou bien ou pas qualifié pour premium assistance là, yo gen sa relé un premium supplémental que yo réduit, un premium qui réduit nan prix.
Okay. If they do qualify for premium assistance, then it will be a different cost. It will be called the full Mass Health premium will be deducted from their premium assistance. We have examples.
Si yo qualifié pour premium assistance, ça veut dire c'est quantité complète ou ta supposé payer pour premium nan c'est li même que premium assistance la paye.
I feel like that was a lot. Are there questions coming in? Because I'm not sure if I'm seeing them. Should I click on comments?
Mwen senti sa en pile, sa information sou ba, est-ce que gen question?
No.
Can I make a comment?
Please.
So generally, if a family's income is less than $150,000, it is almost always cost effective and a good thing to obtain Mass Health secondary insurance.
Si revenu que ou fait li moins que $150,000 par année, on quasi presque toujours puis effectif pour un prix sous prend Mass Health en plan secondaire là.
And once you see the next part of this presentation and see how premium assistance works, you will see why it is so effective.
Lò wè prochain parti nan présentation et pour wè comment premium assistance travail, wè pour ki raison mwen tout ça.
Amy, I have a question. I know you just mentioned 150,000 by household or per person.
It's generally, and that's a very rough number. That's 150,000 for a household of 4 people.
OK. Je dépose mes questions ça parce que là, tu as parlé de $150,000 là. Est-ce que $150,000 c'est pour un seul monde ou bien pour tout le monde? Yo, les dit en total, ça capable aller pour 4 monde. All right, thank you.
But we also work with many families that have much higher incomes, and Mass Health is still cost effective. It's just, we do a few more calculations to confirm that.
Et nous travaillons avec famille qui rentre plus l'argent que ça toujours et li toujours plus effectif pour yo nan prix que yo dépenser. Après nous fait quelques calculations.
I just have one person that sent me a question that says, my daughter has sickle cell. Would it be something that they'll be approved for having Mass Health as a secondary, getting the premium assistance?
Do they have Mass Health already?
I don't think they have it. Because the
So-
question was, would they be able to apply for myself and get the premium
Okay,
assistance?
okay.
So Mass Health determines the disability, and we are most knowledgeable about autism and behavioral health. So I think that sickle cell would be considered a disability, but I would advise her to contact us and we will inquire specifically about that before she applies.
C'est Mass Health qui détermine qui ça qui ont disabilité. Nous-mêmes, nous plus experts pour ba autisme avec santé comportementale. Mais si vous voulez, vous capable rentrer en contact avec nous, nous capable al faire requête là, faire quelques recherches pour nous ba plus spécifique pour affaires anémie falciforme là.
And we have Philomene Jean that just put I don't know if you saw that, Fabienne. She just put a comment. Il met un commentaire, il dit bonsoir. Tout le monde m'a dit un gros merci à nous. Tout qui prend temps yo pour là avec nous, dans le ça éclairci nous en pile bagay. So Philomene is pretty much saying, I'll pass it to Fabienne. I just read it in Haitian Creole.
Good evening, everybody. I want to say a big thank you to you taking the time to be here with us and giving us some clarification over many things.
All right. So I think we can go into premium assistance. Amy, are you okay if I keep going? Do you want to take over? It's up to you.
Please.
Okay. So premium assistance. Okay. So it is a stipend for families who have Mass Health members who also have employer-sponsored insurance that meet certain criteria.
Premier assistance en lui-même, c'est un bourse de type qui est lié pour un membre Mass Health qui gagne assurance qui est sponsorisé par côté à travail. Mais il faut pour l'un côté à travail tout suivre quelques critères spécifiques.
And this premium assistance can really be very different from family to family, but we are seeing higher and higher premiums being paid for employer-sponsored plans.
Premièrement, assistance ça ka différent la différent de famille en famille, li pas même bagay, mais nous remarquer en pile fois en pile premium qui haut, nous ouais payer.
So premium assistance will, if the plan is found eligible, they will typically reimburse the policyholder, the employee who's getting this insurance, for some or all of what they're paying for that insurance.
Première assistance, ça le fait essentiellement si que policy assurance qu'on gagne dans travail li éligible, yo essentiellement ka après rembourser ou même qui gagne assurance ça un peu ou bien tout ça qu'on paye pour assurance ça normalement pour famille.
So if someone is paying $500 a month to their employer for their employer-sponsored plan, and that plan meets criteria, then their premium assistance would be $500.
Si gon moun ka paye $500 le mois dans plan assurance yo gen dans travail là et puis plan ça suivre critères qui nécessaire pour le qualifier et premier assistant a payé un peu ou bien jusqu'à $500 que vous payez le mois.
Of course, now it's Mass Health, right? Mass Health premium assistance. So they are going to first pay themselves back. So from that premium assistance amount, they'll pay your Mass Health premium. So they'll either pay it down or they'll pay it off.
Et vous connaissez premier assistant pour myself que lié. Donc premier fait y a touché par avant, y a touché par ou bien a réduit ça normalement t'as payé pour plan myself là avant que rembourse reste là.
And depending on the numbers, depending on the premium assistance number, and depending on the Mass Health premium, there are many families that will get a check every month because there's a leftover premium assistance benefit after having paid the Mass Health premium.
Dépendant de qui sa premium nan est pour Mass Health là et dépendant qui sa premium assistance là qui quantité au ba ou qui va déterminer si que a bon ti reste qui rete les Mass Health plan fin prend pas là soit bon ti reste qui rete dans pile famille chaque mois yo recevoir un chèque parce que bon ti reste qui rete dans bénéfice en l'air au fin payer plan Mass Health avec quantité premium assistance yo ba yo.
So as you can see, this can be very helpful because it could help to pay the premium that they'd owed, so they no longer owe it, and potentially get some of that money back that they're paying for the family plan.
Oui, elle est vraiment aidé côté que non seulement ou capable payer premium à certain que vous avez pour payer, les fins nous joindre un peu dans l'argent côté payé dans assurance travail retourner venir joindre.
All right. So unfortunately, not all employer-sponsored plans will qualify for premium assistance. So this is something, again, if you call us, we'll look at your plan that you're on for qualifications. Right now,
Malheureusement, et pas tout plan que travailleur sponsorisé qui qualifié pour premium assistant. L'orelé nous ça que nous même nous pral faire, nous pral regarder qui plan qu'on gagne pour nous si plan ça qualifié pour lui.
The two biggest pieces that they look at are the plan's family in-network deductible, or just the deductible, and the maximum out-of-pocket max out-of-pocket. Right now for 2025, those numbers are listed on the screen. $2,950 for an individual, $5,900 for a family deductible, the out-of-pocket max $9,450 for an individual, and $18,000. Actually, that's $18,400 for a family.
400, okay. Et ça que you regarde deux facteurs que you regarde déductible avec maximum l'argent que tu as supposé sortir dans poche. Donc pour l'année 2025 là, pour un individuel, maximum déductible c'est 2,950, pour une famille c'est 5,900. Maximum l'argent que tu as supposé cash dans poche pour 2025, pour un individuel c'est 9,450, pour une famille c'est 18,400. Bon, erreur dans écran, c'est pas 18,900, c'est 18,400.
And I do want to make a note that especially for our families with a loved one with a verified disability, if you have a deductible, a family deductible, or that's $6,000, if it's a $3,000 individual, $6,000 family, we still encourage you to apply for premium assistance. We'd want you to reach out to us, but those plans can qualify for premium assistance if it's a 3,000 individual, 6,000 family.
Donc pour famille côté que disabilité comme si vous confirmez que une disabilité on doit avoir plan lui-même déductible c'est 3,000 pour individuel et puis 6,000 pour famille, ou capable toujours appliquer, nous encourageons pour appliquer, rentrer en contact avec nous, capable toujours appliquer pour première assistance là.
There are other requirements. One is that you have to have a Mass Health member in the household. And another is that the policy holder for that employer-sponsored plan and the Mass Health member should be living in the same household.
Gen l'autre critère tout pour suppose gen faut que moun gen moun nan ka lan qui gen plan Mass Health là et faut moun qui gen plan Mass Health là avec moun qui gen assurance que travail lan ba là faut rete même côté.
Okay. And I see that Philomena has a question. I think it's a question. I don't know.
Yes, my question is, if I have a child with disability and he doesn't have a legal status in the country, because I came here in 2023 and they gave me I-94 for 1 year, and it's expired. I filed for TPS, but they have not given it yet. Now, my problem is my health canceled the insurance, and he's not able to do any therapy. And what can I do to get insurance for him?
Oh boy.
My child is autistic.
I am going to answer that question. I'm going to type something in the chat and you can translate it. That is unfortunately a little bit outside of our expertise, but there is an agency that we would refer you to that could help figure out. There are very, very limited options, but we're going to refer you to an agency that could help you figure out whether there is a way to get that. But for many people with that status, the only way they're able to get services is through their school and their IEP.
Ça, question posée en dehors de domaine nous, de expertise nous, et même capable de faire avec une agence qui option limitée, mais qui est capable de plus assistance dans ça. Et quand pile là, c'est à travers l'école que vous joignez assistance.
Okay, here we have some examples. So, for a family of 4, 150,000 household income, the supplemental premium. So this would be without premium assistance, would be about $198 a month. Okay.
Nous avons un exemple là, une famille qui a 4 personnes là-dedans, yo revenu c'est $150,000 par année, l'on garder premium supplémentaire là, qui c'est premium côté que il pas gagné premium assistance, il dans 198 le mois.
Okay. So with that, okay, so if the calculated so if that same family qualified for premium assistance, then their monthly premium that they would owe or would be pulled, that would be deducted from their premium assistance amount would be $282.
Donc, si même famille ça t'es qualifié pour premium assistant, et ça qu'on apprend qui c'est $282, premium assistant a retiré $200 là-dedans.
So in that first one, so let's say this, the policyholder, the family is paying $200 a month for their employer-sponsored plan. And their monthly mass health premium is $282. So their premium assistance amount would match what they're paying for their employer plan, that $200, and it would reduce the mass health premium down to $82. Did I lose you?
Yeah.
Okay. Yeah. All right. So if let's give it a name. Let's say it's the at the employer has a United Healthcare, and they're paying $200 for that United Healthcare plan. Mm-hmm. The Mass Health is costing them $282. All right. Mm-hmm. So premium assistance is going to match that United Healthcare premium of $200. Premium assistance pays down their Mass Health premium, so it wipes out $200, and they are left still having a $82 Mass Health premium.
OK. Donc, on dit que vous avez un plan United Health avec travail là, et vous chargez $200, vous prenez $200. Ça que et puis pour ma certes, le plan lui-même, vous payez $280, vous chargez. Premier assistant li matché, ça qu'on paye dans le travail qui c'est $200. Mais on connaît, faut payer, ma certes prend pas l'avant, donc il y a $200 que premier assistant bail là. la soustraire de $282 qu'on t'a supposé payer myself là. Qui vient faire que qu'on y a ou bien un premium $82 qui était pour payer plan myself là.
Okay. Now, let's change the scenario. Now, another family is paying $500 for a United Healthcare plan. So $500 becomes their premium assistance amount. From that $500, they pay the $282, and that family will be getting a check every month or a direct deposit for $218.
Qu'on y a changé scénario, on dit qu'on y a que mon nan qui a travaillé assurance travail, il prend $500 sur le mois. Et qu'on y a, ça veut dire que premier assistant matché $500, il ba ou $500 dans premier assistant. Donc premier assistant $500 ça, il utilisé là-dedans pour payer premium myself qui c'est $282. Lorsque c'est $282 dans $500, ou vient rester $218 dans l'argent premium assistant ba ou là qui fait que vous pouvez joindre mon famille ça va joindre un chèque de $118 qui vient joindre chaque mois.
This is confusing. This is confusing for a lot of people. So I just encourage people, if you have an employer-sponsored plan and you have a member in your household that has mass health or you're thinking about it, call us. We can walk it through with your specific information and let you know what you would be looking at within a ballpark. And so I think which can be very helpful for families.
On connaît ça en pile confusion là-dedans. C'est ça que nous encourager pour rentrer en contact avec nous. On a marcher avant moto, faire expliquer en façon pour nous avoir une idée en gros qui ça que ou payer ou bien qui ça que peut-être ou rentrer.
Will mass health be helpful in covering services? So I think we talked a little bit about this earlier. So mass health covers Medicaid eligible services that your employer plan doesn't cover, including your deductible, coinsurance, and copay. So out-of-pocket costs, right? So we talked about, wherever your primary and the mass health are accepted, those costs will be covered for the family.
Oui, nous parlons de ça déjà, oui, qui service que myself couvre et les couvrir n'importe qui depuis son un service qui éligible pour Medicaid, les couvrir déductible, les couvrir copay, tout ça capte dans poche surtout si assurance principale n'a pas couvrir service ça que Medicaid couvrir. Ça fait faut bailler tous les deux quatre lo aller dans côté qui accepter tous les deux quatre.
And as I tried to convey earlier, is that it's a fully comprehensive plan. This is not just a plan that's going to cover ABA copays. So you want to be using it wherever your child or wherever your loved one that has mass health is going. So whether it be to the hospital, to the doctor, to a specialist, even to the pharmacy, you want to make sure that you're getting the most out of that coverage. So wherever you choose.
Et Jean-Marc Psycholon, c'est un plan qui est compréhensif. C'est pas juste comme si pour payer copaiement ABA ou seulement, mais n'importe qui côté parler, qu'on parle dans docteur soins général, dans pédiatre, dans pharmacie, dans salle urgence, by 4 massas là tout, parce que il couvrir tout service ça autour.
Now, many families will come to us and say, well, what if, my specialist doesn't accept mass health or doesn't accept my primary? Can I use my mass health? And unfortunately, the answer is no. You really need to have your provider be accepting of both your primary and the mass health in order to get the benefits.
Il y a une question qu'on vient dire, est-ce que spécialiste que malware pas accepté et plan principal que me gagne avec travail est-ce que me capable d'utiliser myself là? Non, ou pas capable. Faut li vraiment important pour aller en côté qui accepte ni plan principal ou gagnant ni plan myself là pour lui marcher.
only time that this might differ is if it's a non-covered benefit from the primary plan. We
Seul
don't.
le,
Okay.
seul le ça ka marché, c'est si c'est un bénéfice qui plan principal n'a pas couvri même.
So if they don't cover it at all and Mass Health will, then there's a chance that Mass Health will pick up those costs. Amy, you can jump in here at any time.
Si yo pas couvrir du tout, laisse à myself ka font paraître tête li pour li payer.
But Mass Health always wants to be the payer of last resort. So
Même-
it
Myself toujours vle c'est yo même qui pour dernière option.
I will just add, these are the kinds of questions people call us with. So you don't have to memorize this. Just know that if you're utilizing Mass Health Secondary and you have questions like this, you can reach out and we will help you.
Mwen jist vle fò konen, se type de question sa yo ke moun rele nou pou yo pose nou. Ou pa bezan ese memorize sa kap diyan la, ou kapap toujou rele nou e puis nap repon question sa yo tout.
Yes. So yes, the provider must also accept Mass Health. So there are times where Mass Health will do a single case agreement with the behavioral health in order to cover ABA copays.
Gen eksepsyon kote ke myself ka fon eksepsyon kom si sa wè yo fon akor pou un kas spesyal pou yo kapap paye kopayman ABA.
And I went over the second bullet. And a big piece that, we get a lot of questions on is that right now, currently, Mass Health will cover ABA up to the age of 21.
Yon nan kesyon ke nou recevo an pil tou, se kon yan nan mouman, myself ap kouvri pou ABA jusqu'à l'âge 21 ans.
And so that's why for families that have loved ones that are, 21, they, if they're calling, we'll often encourage them, if it's possible, to keep that primary, if there's a primary insurance that they have access to potentially keep their loved one on that so that they could maintain coverage for ABA.
Oui, sa fè gen moun ki rele pou moun ki reme ki gen 21 ans, nou toujou ankouraje pou yo kenbe asurance principal ki yo genyen, en fason pou yo kapap toujou kouvri pour service ABA.
And then Mass Health as a secondary or, will cover Children's Behavioral Health Initiatives, CBHI benefits.
Et myself tout ap kouvri sa rele initiative santé comportement nan ti moun nan, akronim nan se CBHI.
So therapeutic mentoring, other benefits that, primary insurance should be covering it, and we're seeing more and more, but, Mass Health will cover it as well.
Oui, thérapeutique pour comportement, mais ça que assurance principale ta supposé couvrir, mais nous ouais tout côté Mass Health couvrir qu'on y a plus qu'on y a.
All right. So when applying for Mass Health coverage, so there are, like 4 big steps. Okay.
Lo appliquer pour Mass Health protection, il y a 4 gros étapes.
Okay. So the first one is just like I said, that front door, you need to apply for Mass Health.
Le premier partie, c'est passer dans porte entrée, appliquer pour Mass Health.
And many of our families, will get denied at this point. And we say, don't stop yet, because this is just step 1, but you have to get that first application in.
Gan pil nan fami yo ke yo rejte application yo ba bayol, le konsan di yo pa kampe, parce ça c'est juste première étape là.
Step 2 is to do a disability supplement for our loved one with the disability. For those up to 18, it's a child disability supplement. 18 and over, it's an adult disability supplement.
Deuxième étape là fait ça les supplément disabilité si son petit monde c'est child supplement si là plus que 18 ans ou plus là on adulte supplément.
And that third step, it is extremely important. And we actually spoke about it earlier. It's about making sure that once your loved one has Mass Health, if they have a primary insurance, that we are letting Mass Health know about it. We call this, submitting third-party liability.
Et ça, troisième étape là, est extrêmement important. Et nous relais le côté que c'est là que ou assurer que ma certaine information, assurance principale qu'on gagne, et nous relais ça, c'est soumettre troisième partie responsabilité forme, qui c'est third party liability form.
And finally, then you're going to want to apply for premium assistance.
Et finalement, on va vouloir pour appliquer pour assistance, en première assistance.
And then you get to breathe for a little bit. But there is, the upkeep. You will have an annual renewal for Mass Health. And then we always say for premium assistance to put a little flag in your calendar for when your employer does open enrollment, that you want to make sure that the plan will still continue to be eligible for premium assistance, and to make sure that premium assistance gets the updated information before the plan goes into their next plan year.
Oui, gen ba pour faire pour toujours faire maintenance dans plan yo, chaque année faut renouveler plan master là et toujours dit mettez on ba pour faut songer tant qu'on petit rapport il faut songer qui l'heure qui gagne inscription pour assurance dans travail là et pour capable vérifier pour si plan ça il est toujours éligible pour premium assistant et en façon pour capable voir information ça qui ajoute by myself.
And Suzanne, I think, has a question. It says, if your child has recently turned 18, do they need to reapply for Mass Health as an adult? I would typically, if it's a child that has a verified disability, I would say keep an eye out for a notice and an adult disability supplement from the DES team, the Disability Evaluation Services team.
I would add also.
Hold on one second, Amy. She's just
question dit si on ti moun fait 18 ans, est-ce que obligé réappliquer pour ma certe comme un grand monde, comme un adulte? Et si ti moun ça li disabilité langue est confirmé, que vérifier que li confirmé, fais attention gon lettre qui pral venir dans mes équipe yo les DES en disability. Since I didn't, but they took no disability DS now. What was the acronym DES stand for? Disability Evaluation
Services.
Okay. Équipe disabilité qui évalue disabilité. Fais attention qu'il doit avoir une lettre qui vient dans mail qui parle de ça ne t'a pas de supplément adulte supplémentaire.
I wanted to ask a question. Is your child applying for Social Security as an 18-year-old?
Je voulais poser une question. Est-ce que petit ou on l'a pas appliqué pour Social Security comme on petit monde qui a 18 ans qu'on y a?
If they are applying for Social Security, which many children or young adults do at age 18, then they might not have to reapply for Mass Health. They might get it through their Social Security.
Si que y a pas appliqué pour Social Security, qu'un pile fois yo fait, il doit pas obligé réappliquer, il doit tout jeune automatiquement à travers Social Security.
Okay, but there's no SSI here, so then I would just watch the mail. tell everyone to keep an eye on their mail from anything from Mass Health.
We ve let to yo pour wè sou recevoir anken bagay, anken let nan men Mass Health.
And one thing about the mail is, for privacy reasons, it never says that it is from Mass Health. So I got some mail today from a different health plan, but I thought what I had was junk mail, and I just opened it, and it was actually a check from my health plan, but it looked for all the world like a piece of junk mail.
Oui, et Mass Health pou kom si nan let nan presevwa an pil fwa, a cause de rezon kom si pyo kenbe informasyon nou prive, li pa paret ke se nan Mass Health ke li soti. Donc, sa ke fe, fò fè atensyon, parce même de resevwa on let tout, ki paret te ko se let fatra yo kon voye let reklam yo, le mouvel lem gade mwen son chèk nan plan yo.
I just wanted to say I have two parents that asked the same question, and I'm gonna read it in Haitian Creole, and then because that's how it was sent, and then I'm gonna say it in English. So, get deux parents qui te voyé même question, qui dit si myself paye ABA, est-ce qu'il a toujours payé PCA? Là toujours, s'il vous plaît, moi pas moi t'as aimé poser question ça. The question is, if myself pay for ABA services, would they still be able to pay for the PCA services? I would like to know the answer to that question.
Yes.
Yep, they're two different services. Yes.
Oui, se deux différents services la paye li.
Are we good? Okay.
Thank you.
Oh, and well, we're at questions. So
Cynthia, was there a second question? Or
yeah,
was that...
I think there was two parents with the same question. I think that's, yeah.
I have some questions coming in. I just gotta look in through.
Sure.
You guys can go ahead, and I'm gonna bring the questions that I have. Sorry, I have them on my phone coming in.
No, take your time.
I have a
Let me
question.
just also say that there is no charge for our services. And the organization that we referred to in the presentation for Immigrant Assistance Health Law Advocates also does not charge for their services.
Nou pa debe zo fè konen ke nou pa chaje pou servis nou yo. E pi informasyon ke nou te bay sou ajans yo, yo pa chaje pou servis yo tou. I did have a question, because I know you mentioned you were going to write down in the
chat.
The chat.
It's there. I already
okay. But
and
okay.
then I send it to
I wasn't sure if I needed to translate that, interpret that. That's why I wasn't sure.
Okay, I can put it here. That's fine. Can you see it?
Oh, okay. That's the link. So that was for the parent that asked if there was a specific question. If they don't have legal status.
Right.
Okay. Yeah. Ça a été pour parents qui te dit que si ti moun n'a pas gen un statut légal dans pays an, li capable rentrer en contact avec agence ça nous mette lien là pour parce que option était limitée, j'ai dit non mais yo capable ba nous plus option qui ça que nous capable faire.
Okay, so the other one,
Cynthia, that organization, it depending on needs of your group, I'm happy to make an introduction to them if you would like to meet them, just so you know about them as a resource.
Yes, that would be awesome.
Definitely. We will not say no to that.
Since my brain is like a sieve, can you please send me an email and I will make that introduction?
Yep, I will do the follow-up email. Thank you, Amy. So the other one that I have is my 22 years old child is on myself, live on their own. And I cover the private insurance. Can I still get the PA, which is a premium assistance?
They have to live with you to get premium assistance. But depending on how they are living independently. There are families where the child has an apartment, but they come home every weekend, or they're in a group home or another arrangement. So if their legal address, and if a child is away at a school, they are living with you. If they're out of school and they're living somewhere else, their legal address has to be with you. So generally not, if they're living with two friends, in an apartment somewhere, that's going to be harder.
Yeah.
The thing to remember too, though, is regardless of the premium assistance, if your child is disabled, they can stay on your private insurance policy beyond age 26. That's probably a topic for another presentation, but it's an important thing to remember it sounds like there's a few people who have children that are a little older.
Okay.
Cynthia, pose question en créole.
Okay, I'm just gonna ask the question in Haitian Creole. Oui, question qui t'est posée a dit moi gen ti moun 22 ans et li nan myself et li a vivre pour compte pali. Moi-même moi couvri assurance et moi gen assurance privée que travail moi couvri. Est-ce que moi-même moi capable gen PA c'est assistance pour premium nan comme que yo paye?
Non, li pa capable, surtout si li rete indépendamment, la pou oblige bay, faut ni moun ki gen plan massat lan, ni moun ki gen plan assurance privé an, faut rete même côté. Si ti moun nan se l'école la le, et li toujours retourner la ka, li toujours considéré rete la ka. Mais si la vive indépendamment, même si la vive avec deux autres amis, c'est adresse palier, faut moun nan rete même côté. Faut ni moun ki gen massat lan, ni moun ki gen assurance rete même côté. Même ble faire nous connaît tout. Pour bay assurance privée depuis ti moun yo confirmé que li gen une disabilité, ou capable kembel dans assurance privée pour jusqu'à 26 ans. Ça sont l'autre top un sujet que nous capable font l'autre show pour nous parler sur ça plus.
And you guys are ready for the second question? I have like 3 more. The other one was et si assurance moi dans travail là trop cher pour moi payer. This one is if my insurance at work is too expensive for me to pay.
So that is where sometimes premium assistance, which will reimburse you for the cost of that insurance, makes it able for you to get that. But you would want to contact us and we could help you, give you specific advice.
Oui, ça c'est là que si assurance trop cher et la assistance premium n'a pas entrer en jeu pour être capable aider payer pour lui. Mais rentrer en contact avec nous pour nous capable ba ou des réponses spécifiques.
Work insurance is really expensive and it gets more expensive every year.
Assurance en travail vraiment cher et il vient plus cher chaque année.
But when you get the premium assistance, it looks at the entire cost, like for your whole family. So you may have one child with autism, but a family of, family policy, they will reimburse based on the whole cost of the family policy. And it's usually enough to cover the entire cost of the family policy.
Et en pile fois, leur recevoir premium assistant, le plus souvent, il couvre tout montant complet qu'on paye pour assurance dans le travail. Même là que c'est celle qui fait autisme, mais il paye tout plan en entier.
Thank you, Fabienne. Merci. The other question is, l'autre question, c'est que qui dit comme ça, dans le process pour application et assistance premium, combien de temps que ça capable durer? The question is, in applying for the premium assistance, how long the process take?
So okay. I always go through this. So the online application takes less than an hour. The disability supplement can sometimes take people time, because it's a PDF that needs to get usually printed, filled out, signed and dated and sent in. Once it's submitted, that can take 30 to 45 days. I'll stop there.
No, you can go ahead. I'm writing it down.
All right. And then premium assistance, I usually say while that disability supplement is being processed, to get the premium assistance application ready, so that as soon as Mass Health is on the account, you submit the premium assistance application. The premium assistance application can take again another 30 to 45 days. So there can be a month to 2 months where they might owe that Mass Health premium without premium assistance.
Oui, et application générale là, il prend moins que une temps, soit faire en ligne. Là, pour faire en partie disabilité supplémentaire là, ça lui même compte contingent puissant parce qu'il faut imprimer forme PDF là pour remplir, pour signer, les fini pour soumettre. Leur soumettre, ça compte 30 à 45 jours avant que ma sorte sous dossier. Mais pendant le processus disabilité supplémentaire la marché, nous toujours dit préparer l'application assistance premium là en façon que du moins qu'on connaît que ma sorte sous dossier en net qu'on y a ou capable soumettre en premium assistant application et les ça capable prendre les mêmes 30 à 45 jours. Ça veut dire que ou doit ma sorte là dans un mois 2 mois c'est ou même qui doit payer en premium pour ma sorte là pendant premium assistance processus en fait.
And I think this, oh, go ahead, Amy.
We work, sometimes there are families where premium assistance is essential for being able to cover the cost. And we will work with premium assistance to try to coordinate that and try, we can't always, but many times we can minimize the gap, or sometimes, you have to sign up a certain date and it doesn't come for you. We can get the coverage, to the date that you signed up for. Not always, but we will try. So if the person asked, if they haven't signed up for the employer insurance because it was too expensive, but they want to sign up to get the additional benefits with premium assistance, and they want to try to make sure there isn't going to be a gap or too much time, you can contact us and we can try to help you.
Nous connaissons une famille essentielle pour yo gagner premium assistant pour capable couvrir l'argent que vous demandez pour payer dans assurance travail et nous capable travailler avant sur ça fait premium assistance premium pour nous coordonner essayer minimiser gap là qui dans mi-temps et si quand on dit pas de signer parce que pas enregistrer pour assurance travail parce que il était trop cher mais si que tu as voulu pour réussir enregistrer pour lui nous capable travailler avant pour nous comment nous capable faire pour nous faire arriver dans date que au besoin pour capable joindre assistant premium assistance rentrer en contact avec nous n'a capable ba des aides spécifiques.
I think this is the last question, and it's a great follow-up from the previous question. Et question ça, et à moi, quoi, sont bonnes questions qui allaient suivre à question qui t'est posée avant. Là que c'est premium assistance là, comment que vous voyez comme ça ba ou est-ce que c'est un chèque que vous voyez ba ou est-ce que vous êtes capable de déposer les dans banque? When it comes to like the premium assistance, as far as like when they say that payment they're sending to you, are they sending it by a check or can it be in your account?
Yep. The first one will typically be a check, but you can sign up for direct deposit. And they encourage that too. And then it gets deposited every month. I believe it's on the 5th of every month.
Premier, typiquement son chèque que la pied, mais on capable enregistrer pour capable faire dépôt direct dans compte et on encourage pour faire ça. Et normalement, on fait le 5 chaque mois. I just wanted to, because of the question, I just wanted to make sure, because I learned a lot too, that they understand that it's after myself get their money. If they have anything left over, then they get a check.
Yes.
Donc, faut nous songer, c'est les master fin prendre l'argent par là, c'est le ça ou il possibilité pour jouer un chèque si on reste qui était. Et pas tout le temps un chèque.
This is a great point because sometimes we get families that receive premium assistance. They're getting a check, but they are also getting an invoice, a bill. That shouldn't be happening. That's when you need to call us, because from the premium assistance benefit, they're paying your monthly mass health premium. So you shouldn't be getting, you shouldn't be owing anything. So if you're getting premium assistance check, there should be no bill.
Parce que si vous recevoir un chèque assistance premium, ou pas supposé recevoir un bill pour payer premium myself. Si vous tous les deux ça peut-être en même temps, ça veut dire qu'on problème. Donc faut aller nous pour nous essayer fixer ça pour parce que pas soit recevoir un chèque ou pas supposé qu'on un bill un bordeaux cap sorti dans même myself une jeune non plus.
Right. We see that it's 8:00, and then I know you guys have dedicated that time with us, and we don't want to go over because we want to keep having this great training and great information. For especially our community, there are a lot of people that are not aware. They see the health insurance, they get the insurance card, and then they think, okay, I just go to the hospital and then that's it. Or, when something is not covered, they get upset because they don't know everything is a process. So I'm glad you were able to clarify, a lot of the things. And we want to make sure that everybody knows the number and then also the email that I'm going to put in. So that way they can, contact you guys. And I know there's a lot of families that still have questions. They probably didn't ask, and you can email those questions. Why not? You get it from the source, so don't be afraid. And then our Haitian speaking families or any other families that don't even speak the language, as far as English, they can write it on their own language, and I'm sure you guys gonna be able to get it interpreted and get them the answers that they need.
And also, I wanted to mention, because I saw Amy wrote something in the chat, I just wanted to say it in Creole. Ou capable voyer email en créole haïtien ba yo tout et ou capable tout for journal interprète sur les dans téléphone.
We have a language line.
The one you can send email in Haitian Creole and can have an interpreter if they speak by phone. I was just relaying that message.
Yes.
Because besides bonsoir, merci, you're not going to get much help from me.
Come on, Amy. We're going to be teaching you one thing. À la prochaine.
À la prochachaine. Okay, what does that mean?
I mean, see you next time.
Okay.
Okay. Sounds good.
Okay.
We want to build that vocabulary. We're not going to speak two words.
I love it.
Any last words?
I noticed that Amy was able to get the background.
Yes. You see.
I still like yours better.
Any last words you guys want to say before you leave?
No, just
I will not be with you next week. I'm going to be away, but
I will be.
Susie will. And we look forward to working with you.
All right. So we have our last session, which is next week. So we look forward seeing you, Susie, again. And then if you go on vacation, Amy, have a great vacation. Enjoy your time off. And thank you so much for the support that you guys been giving us. We appreciate it.
Thank you. Thank you for having us.
Thank you.
Et nous dit merci ensemble avec Fabienne qui t'a aidé nous ensemble avec
Thank
interprétation.
you, Fabienne.
Et ensemble avec
Thank you.
qui t'a aidé nous. Et après à la prochaine, nous parlons d'une dernière session nous yo et nous dit famille yo partager parce que information ça yo nous besoin dans la communauté nous. À la prochaine. Bye bye.
Bye bye.